Yeah, so I am presenting on behalf of my team from Koforidua Technical University, and also a colleague of ours who teaches at the secondary school. And we are dealing with how we can deploy socially intelligent assistive robots in the context of Africa and the challenges as it has been mentioned. So we look at the background of this study, and these are socially intelligent robots are designed to be able to um, support people who are um, sick, who needs rehabilitation and assistance, and also sometimes companionship. And globally, the aging population of some countries is driving this change, because when people grow old, they need to be helped to be able to manage either their chronic health, and also to be able to have the assistance that is needed. And sometimes you need robots to be able to do that. But although in Africa, um, not much has been done, and there's shortage of particular healthcare professionals. And so it is important that we can develop this in Africa to be able to support, and not to entirely replace these people, but to be able to support people who are sometimes deformed and are sick with chronic diseases. But the situation is quite limited because there is no policy that is driving that. And, L&M has done a study which tells us that sometimes some of these robots are not sustainable within the context of Africa. So the literature that was reviewed looked at the key areas, the infrastructure and economic hurdles, and a lot of studies that have been referenced in the presentation looks at the technological divide between Africa and the developed countries, and you see that there is a problem. So importing and bringing this kind of technology to Africa is quite problematic. A lot of studies have also been done in relation to the ethical regulations. The ethics and the standards of goods and bars are different within cultures. It's also, and there are issues about privacy and security. And these studies have been done by quite a number of people globally, but not in the context of Africa. And one of the key things that we looked at in the literature is economic constraints and affordability. People in the developed world can probably be able to afford and pay for these robotics that are going to help them, according to studies. But in the context of Africa, limited because people are not economically empowered. And it's also user acceptance. And literature says that if you are going to introduce robotics in Africa, then you have to think about how will the rural people, who are majority of the people, accept this interaction with robots. So these are some of the literature that was looked at, and I mean, above all, the cultural and the acceptance levels within and the context of Africa. The theory that was used to carry out this study is the theory of critical disability. And this theory is a framework that does not look at disability as an impairment, but it is shaped by social, cultural, and institutional structures rather than the impairment that people have. And if this is going to be able to be taken, this impairment is going to be taken off, then you have to deal with it with the assistance of technologies. So this study was looked at in the critical disability theory contest. And if you look at the pictures that I've displayed, that we can all see, you see that in different cultures, these robotics are being used to support the elderly and also support those who need rehabilitation. But, you know, the study, the method that was used was a quantitative study. And we did what we call the smaller groups. So we did, 5 in one group to be able to look at with this disability and the caregivers and people who are in policy and those in healthcare. So we put them in smaller groups, and we analyzed the data based on the thematic areas in relation to the objective that we set by looking at the literature that was reviewed. And what the discussion of these our results suggest, as we can compare with other studies that have been done in the context of Africa, is that most of the respondents think that they can be supported by this robotic, but the acquisition, be able to pay for these assisted robots, they don't have the economic and they cannot afford because their incomes are very low and they cannot be able to do that. And this is consistent with what World Organization has done. And because people in the rural Africa and also even in the cities, most of them are on low incomes. And because so to be able to buy and use these assisted robots is a problem. And even in the context of Africa, not many of these are available for people even who are even needed to be able to buy. The other thing that is that about 70% of the respondents do not even aware that there is policy from government and institutions that supports them to be able to use this. So the framework within in the government and in institutions are so weak. They are so weak, and it is not helping in the African context. The study that we did is also consistent with what Maclan et al. Did, and it's also being supported by a World Organization, that there is still weak policy. The other thing, the other theme that was looked at was the cultural and the social acceptance. People within the African context want people to help them take care of them. So in big families, they expect that people within the families are going to be able to support them to become caregivers instead of some robots or some assistants. And some of that thing that we find out is collaborated by other studies. So in the big cultural settings, people are quite resistant because they think that if I deal with a robot, and one of the key things was language barrier, because these robots, and in the rural settings, not many people can speak the English. They only are good at their local dialects, and it doesn't fit within them. And the issue about maintenance is also a problem. If these robots get destroyed, who is going to fix it? Not quite a number of people thought that they could take it where it can be fixed so that they can continuously use it. And the other thing was also about gender considerations. Among the female participants who were disabled, they were thinking, they said to us that if we had female people who could support us with the repairs and also be able to relate to us, then we are comfortable. Because quite a number of the people who could handle this are male, and the female persons with disability are not comfortable when it comes to them being handled by male caregivers. They want to be supported by female caregivers. And this is aligned with other studies that have been done. And this is within the critical disability theory. And it is important that these technologies can be used to support them. The last but not the least is the cultural barrier, the social technical integration challenges that exist within Africa. Across, I mean, there was a broader and weak infrastructure, limited institutional capacity, and fragmented technical systems. And all those who participated think that if we are going to be able to develop this ecosystem, then we need to improve this to be able to support people who are sick, who are disabled, and who need assistance. In conclusion, in Africa, there are issues of economic, infrastructure, and cultural barriers that limit the opportunity for people to be able to be supported by this robotic assistance that can help them to function within their space. We also looked at some limitations because it was a smaller group, and probably in the future, we can do it across cities and also villages to be able to compare. And we can do a qualitative so that we can get so many people to be able to deal with in the future, so that this can be broadly generalized, the situation within the African context. I thank you very much for your attention.